back now. Some time ago, we ran a story about some companies in Nigeria providing care to their patients remotely, especially during the COVID-19 pandemic. But how do we fare here locally? Well, I'm joined by public health specialist, that's Dr. Arvid Azadeh. A very good morning to you, Doctor, and thank you so much for being here this morning.
Good morning, Nishishi. How are you?
Fantastic. Yourself?
I'm very well, thanks.
Good to finally have you in studio. We've been speaking to you virtually for the past few months here.
The new normal.
Yeah, the new normal, eh? So, Doctor, we're talking this morning about telemedicine. Please talk to us about this.
So telemedicine is not something new, actually. It's been around for ages. Some say as soon as the telephone itself was invented by Alexander Graham Bell, his first call actually was to his assistant because he spilled some acid on himself. And that essentially is it. Using ICT or telecommunication infrastructure to get medical assistance, whether it's advice or a diagnosis or some help.
What is the situation in Namibia?
So in Namibia, we always tend to look abroad for solutions, but we've actually had solutions in Namibia for quite a while. And so when I heard this story, I informed NBC that we actually do have some telemedicine solutions in Namibia. The government itself started a project called Project ECHO many years ago, which was supporting rural doctors with HIV counseling and advice. But my company actually is called Macquarie Medical Care, and we started in up to 2012. We were starting to look after remote communities in Namibia with telemedicine.
Mm-hmm. And how was that undertaken?
So essentially what we did initially was just look for solutions for problems. We went to a few remote lodges and tourism spots and realized that tourists are very isolated there. So why don't we have an added benefit of having telemedicine support, where they could have access to a doctor or medication on site so that they could optimize their holiday. Mm-hmm. And very quickly we realized that the tourists have their needs, but it was the local Namibians who were working at these establishments that had daily needs that weren't being able to be looked after. So we really went full board into looking after them, providing them care, medical checkups, and on a day-by-day basis, they had access to call us whenever they had medical complaints or needs.
And in which parts of the country have you?
So all the way up to the Skeleton Coast, the most rural spots. We're looking after a lodge up there, all the way down to the south to the Fish River Lodge. So across Damara land, some remote areas there. It's definitely something that in the more remote areas, people saw the need for it and were much easier to sort of realize the value of what we were bringing.
Exactly. Well, very, very important indeed, very necessary. So you provide diagnosis, counseling of sorts, so to say, but do you also provide medicines to these people?
Yes, so it's in many different forms. So often, you've gone to the doctor, you've gotten medicines, and you'll often have some leftovers at home, but you don't know what to use them for anymore. So the first step always is look at what you have already on site. So with the lodges or with companies, for example, we can put some medicine there that we know is going to be used often. And therefore then we can say, okay, take this medicine or take that medicine. But when we're dealing with individuals who call from their homes, for example, we also can say, okay, what do you have in your medicine cupboard? Let's use this, let's use that. And then let's send you a prescription then to the pharmacy that you can pick up some things in the morning or if it's open right now.
Yeah.
So that really underpins how we do what we do.
Yeah. What would you say have been the biggest stumbling blocks in this endeavor?
I think, it's new to us as a country.
Yes.
So it's always seen as something, that's very foreign, or that's too technology. And that's really one of the main reasons why telemedicine hasn't taken off, is it's relied on a lot of very high-tech technology. And we took it back down to, you can call us on a Tamagotchi phone,
yes,
or you can send us a WhatsApp, or you can just call us with a full video conference, and we can, have a full video consultation.
Yeah.
So we're trying to create as many ways of bringing health in reach, and that's really our logo or our slogan, is bringing health in reach.
Indeed. What about the sustainability of it? Have you partnered with any organizations?
So we actually won a competition last year to be the best startup in Namibia. We've been running since 2012, but we registered the company and our consumer product, Dr. MacQ, in 2016, and then we've been slowly investing and building up and trying to market it as best we can. But we got a lot of sort of when we won that competition last year by Seed Stars, we went and represented Namibia in Johannesburg. Then we started meeting a lot more investors and companies. And in fact, this year, in March, when the pandemic happened, the tourism sector shut down. And our goal always was to move into urban sectors, because in urban sectors, we know people have limited access to care as well.
True.
You know, you may go to the clinic, but it's full, or there's no medicines there, or there's no doctors there. And so we started working in urban areas, and very quickly some companies, you know, signed on to our services. And we've been rolling since then, essentially in Windhoek as well, and now looking at the rest of Namibia as well.
Brilliant initiative, I must say. Briefly tell us about your Dr. MacQ product here.
Yes, so Dr. MacQ, essentially, it's a telemedicine service. What we've done is we've created a network of good doctors who are comfortable using telemedicine services in treating their patients. And we've offered this for companies who need to look after their staff who are working from home, who maybe because of COVID need to be isolated, quarantined, just helping them know when to go into quarantine, how to de-isolate, when to do tests, sending them for tests. So just all of the logistics regarding COVID-19, but also their general day-to-day medical needs. They're now stuck at home, but they can't get their blood pressure medicines, or they can't get out to the doctor, and that's where they can use our services on a daily basis. And then now what we've done is we've actually started rolling out through pharmacies. We signed one up in June already this year to test it out, and we're up to 3 pharmacies right now in Windhoek, and we plan to, by the end of the year, reach 10 pharmacies at least across the country, where you can walk into the pharmacy, see Dr. MacQ, and then you'll know that you can have an online consultation there right now with a doctor wherever they may be somewhere else in the country.
I've seen in other parts of, I believe it was a BBC story where they deployed medicines using drones. Maybe that's something you guys can look forward to.
That is actually a good idea. I mean, in Rwanda, for example, there's a big project there where they're using drones to fly emergency medical medicines, etc. They have more numbers, and that's why it sort of makes sense. But here in Namibia, maybe we'll think about that.
All right. Doctor, thank you so much for being here this morning, and all the best with what you guys are doing.
Thank you.
There you have it, public health specialist Dr. Armid Azadeh talking to us this morning about telemedicines and of course what this entails. Very necessary, and this can definitely go a long way. Stay with us.